Welcome back to Eat the Rich. It's just me today, Cari. This is my first solo episode, and I don't yet have a clever name for it, but maybe it'll come to me while I'm recording. I'm going to be talking about therapy apps today, and I'm mostly going to focus on the biggest players in this space, Talkspace and BetterHelp. You might already be familiar with them. Like other telehealth apps, they offer you the ability to talk to a therapist over video chat, phone call, or text from the comfort of your own home or wherever else you might be. And it's not the first option for most people when they're looking for therapy, but these apps are increasingly popular for several reasons, which we're going to talk about. So I'll talk a little bit about my experience with these apps, and I'll bring it up where it's relevant, but that's not going to be the focus. What I really want to get into is the context surrounding the rise of these apps, a little bit about the people who make and profit off of them, what it's like for providers and patients, and whether these apps actually work. So, like many people last year, I found myself in need of therapy. I've done therapy before, and even though I had quote-unquote good insurance at the time, I knew it wouldn't be easy to find a therapist. So I was kind of mentally prepared for that going in. I've looked for a therapist on my insurance before, and it was always pretty difficult in the last 10 years or so to find someone in-network. So I spent days poring over my insurance company's website, going through the list of covered therapists until I had pretty much exhausted all options within a reasonable driving distance from me. When I called providers listed on my insurance company's directory, I got the same responses over and over. We're not taking on new patients right now, or we're no longer accepting insurance, that'll be $500, or that doctor doesn't work here anymore, our remaining providers are actually out of network. 2 of the therapists listed on my insurance company's directory were actually just dead, so rest in peace to them. If you've ever been in this situation, you understand how hurdles to seeking treatment can make things significantly harder. In recent years, it's unfortunately just been increasingly difficult to find therapists even with insurance. Like me, many patients run into so-called ghost networks of providers when going through their insurance companies, just tons and tons of supposedly in-network therapists that are not in-network at all. A little interesting side note, when you Google this problem, maybe when you're in the middle of dealing with it and don't understand why it's so hard, you get a lot of results explaining why you shouldn't even want to use insurance for therapy, even if you have it, and how it's so much better to pay out of pocket because it gives you so much more control over the experience. This is obviously a little crazy making when that's exactly what you're trying to do. And it also hints at something I want to get into later, which is how this process turns you into a consumer rather than a patient. But anyway, apart from the obvious issues this creates for patients, these ghost networks also represent the information insurance companies then use to determine whether they'll allow new therapists to contract with them. Meaning that some therapists try to sign up to accept insurance, but they're rejected because they're told that their area is saturated, even when there might in fact be a shortage of providers in their area. And all of this leads to increasingly fraying relationships between insurance companies and providers, as well as insurance companies and patients. In spite of laws requiring parity of coverage for mental health, meaning that you should get the same amount of coverage for behavioral health as you do for medical or surgical, insurance companies try very hard not to provide the coverage they're legally required to. Under some plans, behavioral health claims are denied at a much higher rate than medical or surgical claims. Some insurance companies have even had lawsuits brought against them over it because, again, it's illegal. Because it's not really parity of coverage if you arrange limits on a plan to be equal for behavioral and medical claims and then create a situation where the coverage is basically unavailable due to a lack of providers and constantly denied claims. And while these denied claims have an obvious direct effect on patients, they also have other effects. Because insurance companies are constantly looking for ways to screw everyone over, therapists sometimes have to deal with clawbacks or retroactive denials on claims that were authorized, approved, and paid for, sometimes years after the fact. These can total tens of thousands or even hundreds of thousands of dollars in some cases. And even for approved services, insurance companies can directly influence treatment by making it so that only certain therapy methods are covered or requiring massive amounts of documentation based on their own arbitrary and opaque standards. What this can lead to is some providers getting burned so many times or being scared off by horror stories about this to the point that they just choose not to deal with insurance at all. And so for patients, this adversarial relationship between their insurance and their provider, which is often invisible, creates a scenario where it just feels like your insurance is almost useless. It's hard to get concrete numbers on how many therapists are not accepting insurance, but in California, for example, one estimate from a professional organization for therapists suggests that as many as 42% of therapists in private practice in the state don't accept insurance, which is a huge number. I experienced this firsthand in a slightly different way when I lived in Florida. I had a provider announce that he was just going to stop taking my insurance while I was seeing him weekly, and he cited the same reasons a lot of providers do: a high administrative burden and the feeling that working with insurance was negatively impacting his ability to treat patients effectively. I actually had a great relationship with this provider, and one day I asked him why he was asking me about certain things that seemed kind of irrelevant when he was jotting down his notes, and he showed me the stuff he had to fill out during and after our sessions at the behest of my insurance company. It was stuff that just had nothing to do with my situation or my medical history. It made absolutely no sense, and it really did feel like my insurance company was just trying to create a situation where my doctor would fuck up and forget to ask me something so they could deny the claim. So, like patients, many providers feel that they're at the mercy of insurance companies that are bringing in billions while trying to make it as difficult as possible for them to do what they need to do. And apart from insurance issues, there's been an increasing shortage of qualified workers in the US, especially in rural areas, with many areas just not having enough therapists to service the number of patients looking for help. This has gotten worse during the pandemic, of course, but it was already an issue long before. Even before the pandemic, the Health Resources and Services Administration estimated that by 2025, there would be shortages in the U.S. for some provider types equivalent to 10,000 full-time providers. And going back to 2013, the Substance Abuse and Mental Health Services Administration reported that more than 3/4 of counties in the United States had a serious shortage of mental health professionals at that time. So this issue was already present, but the pandemic has sort of highlighted and exacerbated it. I'm just going to read a quick note here from a March 2021 report from the Government Accountability Office, and this is talking about numbers from the National Council for Behavioral Health, which is a member organization for mental health and substance use treatment providers. Quote, in a February 2021 survey of its members, National Council for Behavioral Health found that in the 3 months preceding the survey, about 2/3 of the member organizations surveyed reported demand for their services increasing and having to cancel or reschedule patient appointments or turn patients away. The survey also found that during the pandemic, 20% of member organizations reported laying off employees, 45% reported closing some programs, and 35% decreased the hours for staff. End quote. So that provider shortage has definitely been felt more acutely since the pandemic started. And at the same time that providers are becoming less available, the need for these providers was increasing precipitously. Again, reading from that same report, quote, according to the CDC, 38% of adults experienced anxiety or depression between April 2020 and February 2021. That number was 11% from January to June 2019. ER visits for drug overdoses were 36% higher, and visits for suicide attempts were 26% higher for the period of mid-March through mid-October 2020 compared to the same period in 2019. End quote. For me, even though I'd been through it before, every time I encountered another therapist who couldn't help me or was straight up dead, my resolve weakened and my mental state deteriorated a little. And just as a side note, the times I've been in this situation, I lived in or near a major city, and I had insurance. There are lots of other challenges faced by people in different situations. Uninsured people or people living in rural areas can face even more challenges. So this is a multifaceted problem that has been developing over decades. A real widening gap exists in our for-profit healthcare system, and that's what creates the quote-unquote opportunity for quote-unquote innovators to move into this space. And so that's who I turned to. Was it my first time using an app for behavioral health? I'd used a different app before to fill a different gap in my insurance coverage. When I moved to a different state and couldn't find an in-network provider to prescribe the antidepressants I was on at the time, I got to a point where my options were either finding a way to get my prescription or risk going into withdrawal. So that same provider shortage and ghost directory of providers we were just talking about created a situation where I had to turn to an app that had popped up to profit off of that problem, even though I very much would like to never use an app for anything ever again. But anyway, faced with a similar situation, rather than pay $500 or more for an intake at an out-of-network therapist, I decided to try the talk therapy apps that I kept getting ads for on Instagram. First Talkspace and then BetterHelp. If you're not familiar with these apps and their services, let me just describe a little bit about how they operate. Talkspace charges between $65 and $115 per week. On their site, they have a lovely little message front and center that says, "Feeling better starts with a single message." And they have a handy little list of all the stuff their network of qualified providers can help with, depression, relationships, anxiety and stress, parenting, LGBTQIA+ issues, chronic illness, eating disorders, anger management, and the list goes on. They also offer medication management, which I think might be relatively new because I don't remember seeing that on their site when I first used it. They do take some insurance plans, noting that they work with many employers, health plans, employee assistance programs, and educational organizations to, quote, make therapy available and affordable. Unlike Talkspace, BetterHelp doesn't accept insurance, but they have a similar billing structure, charging between $60 and $90 per week. Also, unlike Talkspace, they do not offer medication management options. The front page of their site says, quote, tap into the world's largest network of licensed, accredited, and experienced therapists who can help you with a range of issues, including depression, anxiety, relationships, trauma, grief, and more. With our therapists, you get the same professionalism and quality you would expect from an in-office therapist, but with the ability to communicate when and how you want. End quote. And we'll see if that's true. Spoiler alert, no, it's not true. But these offerings from both services are pretty standard among web therapy providers. At a glance on this website I found called drmental.org, most of the top apps right now are in this price range and offer kind of the same range of services and market themselves very similarly. Incidentally, there is a whole ecosystem of horrible little websites around these services which compile information on them and then, of course, take a referral fee when you click their link to sign up. It's not very hard then to understand why Dr. Mental would rank every service on his site close to 5 stars. Honestly, I get the impression that this guy might not even be a real doctor. But anyway, all these services stress flexibility and ease of use and offer the promise of access to a huge community of licensed mental health professionals who are available pretty much 24/7 because they live in your phone. Even though it's not realistic to have 24/7 access to your therapist, they really emphasize this on-demand aspect of their services without ever outright saying it because they want to be able to defend against it when therapists say that this is actually really unethical. Like I said, BetterHelp offers their services when and how you want. Both apps advertise this ability to message your therapist anytime, from anywhere, without having to worry about scheduling. It's all about flexibility. Talkspace even boasts on their front page that they're so flexible, they give you the ability to seamlessly switch therapists at no extra cost at any time. And maybe we'll go back to why that specifically is not great when we get towards the end. And I want to highlight here something I'll go back to in more detail, which is that both companies stress that their service is not just equivalent to traditional therapy, it's superior. BetterHelp does this in a slightly vague way, with a handy little comparison chart on their front page with a bunch of X's instead of check marks in the in-office therapy column, showing that it's inferior as compared to the many benefits that BetterHelp offers, like messaging anytime, chat sessions, video sessions, etc. It kind of looks like something you'd see if you've ever shopped online for like a phone or a laptop, and they have those charts with a side-by-side comparison of features, and it kind of goes back to that idea of being a consumer instead of a patient. Talkspace actually goes a bit further with it. They claim on the front page of their site that their service specifically is more clinically effective than traditional therapy, with a handy little chart with 2 columns, one labeled Talkspace and one labeled Face-to-Face, supposedly showing that more patients experience a clinically significant change in their symptoms with Talkspace than they do with face-to-face therapy. Next to that, it also says 80% of patients found Talkspace to be as effective or more effective than traditional therapy, and 98% of patients found it to be more convenient. That sounds amazing. That's a really big claim. Could it be true that this affordable, on-demand, innovative, seamless service is better than the original thing?
It's false. No way. Not this time. We created it. Not this time. No, not this time. It's totally made up. Pure fiction. It's fiction. It's fiction. We made it up.
That's right. They made it up. They don't provide sources on the patients who said they found Talkspace as effective or more than traditional therapy, but we can assume it was based on surveys sent to users. They do provide 2 sources for the chart that claims Talkspace is more effective than in-person therapy, and I read both of them. The first study is from 2001, before Talkspace existed. It's titled A Survival Analysis of Clinically Significant Change in Outpatient Psychotherapy, and it talks about the number of sessions needed for patients experiencing varying severities of symptoms to report clinically significant positive change in those symptoms. This seems to be where they got the base numbers for how effective face-to-face therapy is. The most generous way I can react to the way that they've used these numbers is to say that it's extremely misleading to reduce this article and its contents to 2 numbers and claim it represents the overall effectiveness of talk therapy. The second article, titled A Study of Asynchronous Mobile-Enabled SMS Text Psychotherapy, is from 2018 and was directly sponsored by Talkspace. The 2 authors listed, Thomas D. Hull and Kush Mahan, were current Talkspace employees at the time the research was conducted. One issue here is that their reductive graphical representation of this study on their front page doesn't specify that this is specifically about texting. You have to hunt down and read the study to realize that. It just says this is how effective Talkspace in general is, which is not even what the study was about. The other issue is something that I'll get into in more detail later, is that the researchers picked patients for this study that were more than likely already very happy with the service by only surveying users who had been on the app for several months, and then used that to gauge the overall effectiveness of asynchronous text therapy. So, at best, this claim that Talkspace is more clinically effective than in-person therapy is a bit misleading, and it's not backed by their own sources. So again, for both companies, while it's not clear that there's anything to back up that this is the experience of the average patient, this language about their services being more convenient or more effective or more innovative is found in their ads and on their websites and in their sponsored reviews. In the case of Talkspace, they even promote how employers, schools, and insurance companies can use their platform to keep their costs down. Taking this all in, you get the sense that they're advertising the technology more than they are the care, which is likely because the people behind these apps don't have a background in behavioral health or even healthcare in general. And that brings us to a classic Eat the Rich question. Who are these sickos making money off of your inability to find a therapist near you? At Talkspace, we have Oren Frank, a former advertising executive. He and his wife, Roni, supposedly launched Talkspace after a good experience in couples therapy because they believed that mental health care is a moral right and that everyone should have access to the support and value psychotherapy provides whenever the need or want arises. They call this therapy for all. And if Shane was here, I'm sure he'd do the Bernie voice and ask if this is such a radical idea. And it does sound pretty good, right? Of course, I don't think they really believe this, but they do put a lot of effort into creating the impression that they do. Oren says he believes the app helps him redeem and repent for his years spent in advertising, and he and his wife say this kind of stuff a lot in interviews. It really just reeks of bullshit after actually using their app. His wife and co-founder Roni is a former software developer who was studying to earn a master's degree in psychoanalysis and psychotherapy, but she quit to found the company. Some sources say she did not go back to school to get her degree, but I will give the benefit of the doubt to the one profile I found that says she did end up with her degree after all in 2013. For that, she worked as a software developer for 6 years and earned a bachelor's degree in computer science. And so with all that experience, she now serves as the head of clinical services for Talkspace, despite no indication that she has a clinical background to qualify her for such a position. It's hard to imagine someone with this background heading clinical services at a traditional provider group, but I guess when you found a company, you can just kind of give yourself any position that you want. Looking at BetterHelp's founders, we have Elon Matas, and I will just let the way he explains his background on LinkedIn speak for itself. Quote, I've taken several online ventures through their entire life cycles, conceptualizing, planning, fundraising, team building, product design, development, launch, iteration, commercialization, optimization, growth, and eventually M&A, end quote. M&A, by the way, means mergers and acquisitions. So basically his background is in managing every step from creating an online venture to making it profitable. Elon says he got the idea for BetterHelp after he had a hard time finding a therapist that could accommodate his busy schedule, and that he felt traditional therapy was just kind of inconvenient and too expensive. It's a little hard to imagine that it was too expensive for him after successfully founding and selling 3 startups, but I guess we'll have to take his word for it. His partner, Danny Bragonier, has a BS in statistics, and before founding BetterHelp, he worked for Billy.com, a website that allows you to search for home improvement professionals. Danny did market analysis and product management for them. And what I'm getting at here isn't to say people can't change career paths. I'm doing that right now myself, and I'm available if anyone wants to hire me. But it is telling that across the board, These are people who are more experienced at creating and selling products than they are treating patients. It's hard to imagine that they all had a change of heart about their career paths because of a deep desire to help people in need, especially given the rates they charge. Based on their professional backgrounds, the reality is likely closer to them having an eye for profitable online ventures. And besides, it's a little too convenient that they all realize the importance of therapy around the same time. Talkspace was founded in 2012 and BetterHelp in 2013, very close to each other. And so thinking about that, I wondered what else was going on that made these business and marketing and software folks so aware of the need for remote therapy. It turns out Dr. Phil also launched a telehealth app around the same time. You've likely heard of it. It's called Doctor on Demand. And Teladoc, which would actually go on to acquire BetterHelp in 2015, had already been around for a while at that point, but around that time, they raised millions more in funding and their business really started to explode. They doubled their revenue in 2013. So it was a very, very good time for these apps. And to understand this moment they were having in the 2010s, we have to go back to the Affordable Care Act. If you're an American, you're likely already familiar with the Affordable Care Act, also known as Obamacare. Even if you never looked too far into it for whatever reason, you probably remember the panic and debate around President Obama's death panels. Here's a little clip of Barbara Walters and Sarah Palin on that.
President Obama stood before a joint session of Congress and said there is no such thing as a death panel. Is he a liar?
He's not lying in that those two words will not be found in any of those thousands of pages of different variations of the health care bill. No, death panel isn't there.
So what was in it? In the simplest terms, according to healthcare.gov, the ACA had 3 goals. 1, make affordable health insurance available to more people. 2, expand the Medicaid program to cover all adults with income below a certain threshold. And 3, the one we're really interested in, support innovative medical care delivery methods designed to lower the cost of healthcare generally. And it was enacted in 2010, with certain provisions rolling out over time. An important part of it was the employer mandate, which requires employers with over 50 full-time employees to offer insurance to their full-time employees and their children or face penalties. And what I found looking into this was that there are a lot of articles about what a boon the ACA was for the telehealth industry. Depending on what you're reading, it gets framed a little differently. Some sources mainly talk about how telehealth could improve accountability, ease of access, and outcomes, and so it's so great that the ACA is facilitating the expansion of telehealth. Like I touched on briefly earlier, provider shortages have long been a problem in rural areas and elsewhere, so a lot of the media around telehealth touches on how it can alleviate that issue. But a big driver in the push toward telehealth was the concern that over time, as more people became insured, there would be a general shortage of doctors to provide traditional care, both primary care physicians and specialists. At the same time, insurance companies and employers who were newly subject to the employer mandate had their sights set on keeping costs low. And so the idea was that telehealth could kind of step in and fill that gap created by existing and looming shortages while also costing significantly less for employers, insurers, and theoretically providers. Reading from a 2014 Fortune article about the ACA and telehealth, quote, "The law puts pressure on doctors' offices who are seeing more patients as well as employers who are looking to cut healthcare costs. As a result, telemedicine is becoming increasingly popular as a cheaper alternative to going to the emergency room. Insurance companies including Aetna, Blue Shield of California, and Oscar, which offers Obamacare plans on New York's health exchange, have recently signed on with Teladoc, as have Home Depot, T-Mobile, pension giant CalPERS, and others. The Affordable Care Act is certainly an accelerator for us, Gorevic says. And that's Jason Gorevic, the CEO of Teladoc at the time. Continuing with the quote here, more than half, 52% of large employers plan to offer telemedicine in their health coverage in 2015, up from 28% this year, according to a recent survey, end quote. And that Teladoc CEO goes on to say in this article, we're a lot like Uber. We were first, though. Which kind of betrays the real problem with this and the real motive, which is simply to gigify health services. And when you gigify anything, workers suffer, consumers suffer, basically anyone who doesn't own the gig platform suffers. With apps that aim to gigify health services, patients often suffer as they're inserted into a profit calculation that defines them primarily as a consumer instead of a patient, like I mentioned earlier. A 2015 article from govtech.com cites multiple industry experts about how telehealth has the potential to revolutionize access and availability, and how they predict its use will become widespread, while at the same time citing potential challenges with licensure and insurance reimbursement. Another 2015 report, this one from California Healthline, talks about the mutually beneficial relationship between the ACA and telehealth, and it has some quotes from Kathy Chorba, Executive Director of the California Telehealth Resource Center. Quote, Chorba tells California Healthline that telehealth can also help improve access to specialty care, particularly mental health services, which are tied to primary care under the ACA. Chorba says mental health services can efficiently and economically be delivered via telehealth, adding, utilizing telehealth technologies to access specialty care will help primary care providers to obtain the right care at the right time for the patient, which will theoretically decrease the number of times that patient returns to the office for the same diagnosis. End quote. The report goes on to talk about the barriers that still exist that might impede that beneficial relationship between the ACA and telehealth providers, again citing state licensure rules. At that time, in 2015, the report says, licensure laws across all states hadn't caught up with the technology, so you might only be allowed to be seen by providers who lived in your state if you were using a telehealth service. And for telehealth platforms providing behavioral health services, that's where PsyPact comes in. PsyPact, short for Psychology Interjurisdictional Compact, is an agreement allowing psychologists in participating states to practice across state lines, and it covers both telehealth and temporary in-person practice. But the interesting thing for our purposes is the telehealth bit, and that today there are 27 member states which allow for this kind of interjurisdictional psychology practice. Before the pandemic, that number was about half that. 3 states joined PsyPact and enacted laws in 2020. 9 states did the same in 2021. At the same time, 39 states enacted temporary measures to waive certain licensing requirements that might restrict interjurisdictional practice during the pandemic. And so, with declines in staffing for traditional in-person services, increased demand for services, and increasingly relaxed policy around telemedicine, the pandemic has strengthened and solidified the position these apps have in our healthcare system. It's created a perfect storm of profit-driven partnerships and policy, overwhelmed providers, and patients desperately seeking help. Looking specifically at the period of the pandemic, in April 2020, first-time downloads of the top 20 mental wellness apps in the US hit 4 million, up 29% from 3.1 million in January. By contrast, first-time downloads of the top 20 such apps fell 30% during the same period in 2019. In February 2020, like I mentioned, states started waiving licensing requirements, allowing therapists to more easily practice across state lines. In March 2020, the Department of Health and Human Services granted therapists permission to communicate with patients on platforms that don't meet HIPAA security standards. And in April 2020, the FDA announced it would relax its vetting process for mental health apps. And BetterHelp downloads grew 60% from January to April 2020, compared to just 15% in the same period in 2019. Talkspace saw their new user count nearly double between mid-March and May 2020 versus the same time period in 2019. And so you might wonder how these apps could keep up with a level of demand that traditional services couldn't. Our friend Elon from BetterHelp wasn't worried about this. He was quoted in one article as saying, in terms of kind of a supply and demand approach, demand is definitely spiking, but our supply is also shooting up. So we're still pretty confident on being able to accommodate this. And so they did rapidly onboard a ton of new therapists to meet this increase in demand. For this part, I'm going to focus mostly on BetterHelp because it's a little bit easier to get their therapist numbers, and also because they directly describe their vetting process to me, and I want to talk through that. Now, according to their own numbers, as of June 2020, BetterHelp had around 9,300 licensed therapists working through their platform. You can see this on the archived version of their site, and you can kind of track that growth over time if you just step through the archived versions of their site using the Wayback Machine. At the time I'm recording this, in December 2021, they have over 20,000 therapists working for them. So that's an increase of over 100% in about a year and a half. So how did they do it? What does their hiring process look like? And what makes it so scalable that Elon wasn't worried? And as a starting point, I'd like to read a portion of what BetterHelp's Twitter account shared with me when I inquired about their vetting process. Quote, our vetting process starts off with ensuring that every therapist on the platform holds an independent clinical license and is in good standing with their respective state licensing board. Before they're approved onto the platform, therapists are required to have a video interview with a member of our onboarding team, pass a criminal background check, and successfully complete a clinical assessment reviewed by our in-house licensed therapists. Once therapists are approved onto the platform, our clinical operations team continues to make sure they're providing quality care to our members. End quote. So that sounds pretty good. No real issues jump out at me right away. It's kind of skimpy on details, but what can you do? In any case, you'd assume that there are at least a couple of people involved in this hiring process, right? So maybe they also hired more people to run those video interviews and background checks and clinical assessments. Otherwise, how could they possibly keep up with that many applicants? If you assume that they maybe accept half of the therapists that apply, that would mean they went through at least 20,000 applicants being vetted during this time period. That's a lot. Now, my first thought when I was looking at this information was that the vetting process gets easier if regulations around interjurisdictional practice are relaxed, and if BetterHelp just kind of relaxes its process a little bit, or maybe just doesn't train the members of their onboarding team properly because they're having to hire so fast. And while my wild allegations in that regard aren't necessarily totally unfounded, after looking at therapists' firsthand descriptions of the vetting and hiring process, it turns out the truth is a lot closer to this. Their vetting process was just never that rigorous. And you can get an idea of what that process is like by looking at Glassdoor. Glassdoor is a site where employees can anonymously provide reviews for companies, as well as insights into what the interview process is like, both from people who did and did not receive offers from any given company. And I'd just like to read from a few interview descriptions from people who accepted offers at BetterHelp. I'll read the date first and then their description. October 2018. There was no formal interview and everything was completed electronically. It included a review of my credentials and simple Q&A/FAQs, checked licenses and liability insurance, reviewed their contract, developed profile and website. June 2019. Video interview lasted very briefly. Before the interview, I completed an online profile and uploaded all documents. During the interview, there were very few questions asked. It was smooth due to everything being completed before the interview. September 2020. It was very easy. Just met online and person read script. I was allowed to ask questions, not too much to explain. It was very casual. They did ask to see my ID. October 2020. You are asked to complete a short assessment and then write a response to an example of a first message from a potential client. Then you are moved to the interview, which is just someone verifying your ID and clarifying any questions you may have about the site, etc. August 2021. Online. That's just the first complete sentence in this review. Online. Really just tested the camera and platform usage, including the background shows in the office, and to make sure no dogs were barking and kids crying. The spoken grammar wasn't great. Not just abbreviated or slang, but actual mispronounced words, and an S added on the end of words where they didn't belong. So the impression that you get looking at these is that as long as you're licensed and have a valid ID, you're pretty much golden if you want to become a therapist on BetterHelp. And so the next question is, do you really want to work for BetterHelp? Once you get through this relatively simple interview process, which is generally described as taking anywhere from a couple of days to a couple of weeks, you get to reap all the benefits they offer. Looking at a job posting that's up in my area, some of the benefits of working for BetterHelp include being able to focus 100% on counseling, since they find you patients and handle all your billing, support, and operations. Flexibility, you choose your caseload size and set your own numbers. And in addition to that, when you take on a full caseload of 40 to 50 hours per week, BetterHelp covers health, dental, and vision benefits. On Twitter, BetterHelp said the following to me over DM, quote, regarding working conditions, our therapists have complete control over their caseload and working hours. BetterHelp's therapist compensation is significantly higher than the prevailing pay rates for therapists employed in almost all categories and all metro areas. We are also the first and only online network that pays for the health benefits of its contracted therapists. Wow. All of that sounds great. Until you look at the actual reality of working there. BetterHelp actually updated its pay scale for therapists just this year, which is convenient given how much hiring they had to do. And I want to read this particular Glassdoor review from November 2021 because it talks about the pay and it also hits on almost everything that sucks about working for BetterHelp as a therapist. Quote, the compensation is terrible. They only pay you for up to 45 minutes. Most clients go over, so you end up making $22.50 max, unless you do way more hours. I end up putting almost double time in for what I get paid for. Although BetterHelp collects a decent fee, sometimes around $120 per week per client, they end up paying us pennies. They still collect $120 a week, but only give therapists $15 for a no-show. BetterHelp is a great platform that benefits clients and the higher-ups that rake it in, but it is a quick road to burnout without the compensation to make up for this minimum wage job. In order to make their $70 an hour wage, which they only give you for hours 35 to 40, you would actually have to work about 70 hours. They did start offering healthcare benefits, but only if you work their version of 40 hours. You would have to see 53 clients a week to do that. End quote. 53 clients a week. If that sounds like a lot, it's because it is. This review also hints at what I think happens on these apps, which is that the relationship between therapists and patients, when mediated through this platform, becomes really adversarial. Therapists feel overworked and taken advantage of by patients who have no idea what's going on behind the scenes. This can lead to burnout, and burnout, of course, can lead to a lack of empathy, which is a really serious issue. Continuing to look at the pay for a moment, a post from the social work subreddit from around the same time as that review, 10 months ago, titled BetterHelp's Updated Pay Scale is the worst one yet. Clinicians go look now, they practically have the therapist working for free, also talks about the issues with the updated pay scale, stating that therapists no longer even get paid for messages sent via the app outside of a scheduled session. So those anytime, on-demand messages that patients would naturally expect their therapist to read and respond to are totally unpaid. This isn't a reasonable expectation to begin with, right? You wouldn't expect to text your face-to-face therapist on a weekend and have them respond. You might call them in case of an emergency, but in most cases, therapists are not available outside of appointment times, especially not for free. The rest of the post covers the same issues as the Glassdoor review, and this therapist estimates similarly that you would need to see 40 to 50 patients per week to make a living working on BetterHelp. That is, unless you have a second job. So you can imagine this burned out therapist getting texts on the weekend, maybe while they're at their second job, and it becomes clear how that might lead to a really bad experience, not just for the therapist, but for patients as well. In the replies to that post, one therapist says they've only made $18,000 per year working on BetterHelp, and another laments that the only reason therapists even try BetterHelp is because, like I talked about earlier, private practice and dealing with your own billing and insurance and other administrative issues can be incredibly overwhelming, especially for new therapists. And these companies understand the issues that therapists face in a traditional setting, and so they advertise solving all of those problems for them. BetterHelp seems like an attractive option when they tell you you can make a living working with them, helping people, and you won't have to worry about all of that unpleasant stuff that usually comes with working for yourself as a therapist. But the pay just doesn't work out the way they advertise, and the caseloads are overwhelming and unmanageable. Again, going back to that review, you'd have to see 53 patients per week to have a full-time caseload that gives you a living wage and benefits. And I saw numbers around this range thrown around a lot by therapists discussing this online. Some said a little less, but it does add up that 53 45-minute sessions per week comes to about 40 hours. Now, I don't want to leave Talkspace out of this part completely. I did find information about their caseloads. One therapist on Indeed, a site similar to Glassdoor, stated that at one point at the peak of profitability, they were carrying around 50 clients and making around $4,000 per month, but the pay structure changed, just like BetterHelp's changed, so they stopped accepting new patients, and now they make around $1,000 per month with 20 clients. Another therapist on Indeed stated Talkspace pays for those on-demand messages by word count, and that live sessions end up only paying around $20 each, similar to BetterHelp. They didn't say what the word count rate is for those messages in that review, but several sites confirm that it's only $10 per 1,000 words. In response to a telehealth.org article about working for Talkspace, one therapist said, quote, I worked as an associate network clinician for them for about 6 months as I was desperate for a job that would hire an associate clinician during the pandemic. It was a nightmare from day one. They're all about quotas and keeping a caseload of 80 to 100 clients and keeping a high level of engagement with clients. This made me go back to Glassdoor and Indeed, and I saw multiple therapists referencing this number, saying they were expected to keep their caseload close to 100 because the expectation is if they're mostly doing text therapy, it's not a problem. So to recap, on both of these apps, if you're working full-time, you're seeing at least 50 patients for live sessions and possibly up to 100 for asynchronous text therapy. You're making around $20 per live session, $0 for messaging on BetterHelp, and a whopping $10 per 1,000 words for messaging on Talkspace. This is incredibly low, given the obvious emotional aspects of this type of work and the implicit requirement that you be on call 24/7 in case you get a chat message. Leaving aside the absurd caseload for asynchronous text therapy, let's compare that live session caseload of around 50 to traditional face-to-face therapy. The ideal caseload is a subject of debate among therapists, but many find anything over 30 is unsustainable. And depending on where you look, ideal caseloads are often self-reported between 15 and 25 if money is not a concern. So what happens when you double or triple that number? To answer that, we can look at studies that look at the relationship between caseloads, therapist burnout, and patient outcomes. A 1989 study showed that therapists who were dissatisfied with their caseloads, as many Talkspace and BetterHelp therapists are, were more likely to experience burnout than those who were happy with their caseloads. I also came across a 2004 study that looked at a few dozen therapists and a few hundred patients over a period of several years that explored the correlation between a number of factors, including caseload, and patient outcomes. The researchers noted a significant drop-off in treatment effectiveness when a therapist had a caseload of 25 patients or more per week, and the effect was even more dramatic with caseloads of 30 or more per week. Similarly, a 2018 study found that therapist burnout is correlated with poorer treatment outcomes for patients. So you have these therapists working for low pay with overwhelming caseloads that we know can lead to burnout and poor outcomes for patients. And that's what I want to talk about next, patients. I want to go back to a distinction I made earlier, patient versus consumer. The way that these services are advertised, and even the way we talk about doctors and health insurance in general now, is all presented as this freedom and flexibility to choose the best option that works for you. It's presented as a voluntary and even ideal way of engaging with healthcare if you ask the guys who make these apps. You know, if you feel like it, you can see a doctor online, you can change your doctor anytime, etc. And isn't it so inconvenient to go to the doctor in person anyway? But it's not voluntary, and it's far from ideal. You're not able to access the services you need in person, and the answer offered is to pay out of pocket for an app that supposedly does the same thing. Then you head over to drmental.org to compare the various apps that will give Dr. Mental a referral fee when you sign up. You become a shopper rather than a patient, hunting not just for the best deal, but ultimately for any provider that will give you the help that you need. So what is it like to get this help from overworked, underpaid, burned out therapists on apps created by people who have no business anywhere near the field of behavioral health? Going back to my own experience for a moment, my experience on both of these platforms were actively harmful. On Talkspace, my therapist no-showed more than once, and I just gave up on it. This makes perfect sense when you consider she was likely juggling anywhere from 50 to 100 patients. A few weeks later, still needing help and knowing that my insurance company was beyond useless, I tried BetterHelp. I was super open to the idea that it could work despite my experience with Talkspace because honestly I really needed help at the time. And that ended up being one of the worst therapy experiences I've ever had. I did a live text session with the therapist I was matched with, and as I went into my background and explained my past struggles with suicidal ideation, the therapist just kind of said "oh" over and over. As I described my issues with my job at the time and some stuff I had going on in my personal life, she gave me advice like, quote, "This has all come due to extreme anxiety. Anxiety is all about worriness." As you can probably tell by how that's phrased, all her messages were riddled with typos, and I got the impression that English wasn't her first language. English isn't my first language either, and this wouldn't normally be a problem for me, but it obviously is a real impediment to our ability to communicate effectively over text in such a sensitive context. Seems clear to me that my therapist really could not have gotten through the vetting process that BetterHelp described to me over Twitter. But I can see how she could get through the vetting process described by therapists on Glassdoor, which occurs mostly over email and requires only a very short interview. I tweeted about my experience at the time, and again after a recent tragic event, the Astroworld Festival Crowd Crush. A few days after it happened, Travis Scott announced he would be partnering with BetterHelp to provide a free month of counseling to people affected by the events at the festival. To me, it seemed obvious that this was a really bad idea. First, the idea that a month of sort of generic web-based therapy would be good enough to help people who just lived through a mass casualty event is frankly absurd. And secondly, of course, my own experience with this service and others like it made me feel that these apps are just really not equipped to handle anything that you might consider a crisis. No matter how convenient the service claims to be, how much they pretend the therapists are qualified, it doesn't make sense to me on a personal level to risk the mental health of already fragile people by putting them in the hands of a platform that's just hit or miss. And I want to be clear also that while my experiences made me want to look into this, I'm not just basing this off that. After trying and failing with these services, I started wondering if I just had bad luck or if this was a broader problem, and I started looking into what other people experienced. Of course, there are tons and tons of glowing reviews for these services. That can, in part, be attributed to the fact that they pay influencers and YouTubers to basically just pretend to have used their services to drive people to their site. Both companies use social media, influencers, brand partnerships, celebrity partnerships, even institutional partnerships to lend themselves legitimacy. So you might get an ad on Instagram about normalizing needing help, featuring one of your favorite celebrities, and think, why not? I need help, and if it's good enough for my favorite singer, it's good enough for me. Getting therapy in person, as we've seen, is increasingly difficult, and you might think, what do I have to lose by trying it out just on my phone? Aside from a few $100s, of course. And I do want to acknowledge that, of course, bad experiences are not unique to telehealth. It's true that traditional therapy doesn't always go well. I've had bad therapists in person. I also struggle with treatment-resistant depression, and so I try not to generalize my experience when I'm thinking or talking about therapy, because I know my experience is not always representative of larger trends or how other people experience things. Talk therapy is generally very effective for treating things like depression and anxiety. And like any healthcare experience, the specifics of your condition, the provider, and many other factors can affect the outcome. So of course it follows that the same is true for online therapy. But how does it directly compare to face-to-face therapy? Some studies have shown that online therapy is effective, just as effective as face-to-face therapy in many cases. A 2019 study about BetterHelp, titled Effectiveness of a Multimodal Digital Psychotherapy Platform for Adult Depression, a Naturalistic Feasible Study, concluded that, quote, users of BetterHelp experience significantly reduced depression symptom severity after engaging with the platform. Study findings suggest that this intervention is equally effective across gender, self-reported financial status, and self-reported physical health status, and particularly effective for individuals without a history of psychotherapy, end quote. And these findings were based on self-reported information gathered via a questionnaire in the app before and after treatment. But this study and others like it have limitations. The pool of users for these studies frequently excludes the most vulnerable patients who are seeking help through these services, those who are experiencing suicidal ideation or have a history of severe mental illness. In this particular study, patients who used the app for less than 90 days were also excluded. And as I touched on earlier, that Talkspace sponsored study, which they used to claim Talkspace is more effective than traditional therapy, was limited to people who had been using the platform for 3 to 4 months. What this leaves is a pool of people who are obviously happy with these services. Otherwise, they wouldn't keep paying hundreds of dollars per month. Follows that this is a pool comprised of people who feel that the service is helpful to them. Most people wouldn't pay hundreds of dollars per month for a service that just wasn't helping them. And so the effects on patients who are early in their treatment or patients who abandon the service due to poor or harmful experiences are not investigated. And just like the Talkspace study, the authors of that 2019 BetterHelp study disclosed past and current affiliations with BetterHelp. So these are researchers who work for the services they're evaluating, and they're effectively creating a pool of happy consumers who naturally make easy, happy patients and prove how good their services are. So let's grant that for users or patients who use these apps for several months to deal with certain conditions, these apps probably work at a similar level to how in-person talk therapy works. But what about those other patients, the ones that are left out of the sponsored studies? The patients who quit after their therapist never shows up? The ones who get matched with a therapist who's unable to communicate with them? Or worse? Like I said, I posted about my experiences, and when I did, I had a lot of people DM me about their experiences on these apps. Without divulging anything that was shared with me privately, I'll just say that a lot of it matched up with what I experienced, and in some cases, it was worse. People who didn't have issues with no-shows or communication barriers described getting generic advice that felt like it was almost coming from a bot, and that it just didn't compare to the type of help they had received during previous in-person therapy experiences. There are cases where therapists are taking on clients that they just simply are not qualified to work with, likely because of the low pay and platform-imposed quotas. But those aren't the only ones. Because of the way these platforms are set up, there's not a lot of thought given to traditional ethical standards that normally apply to therapist-patient relationships. For example, except in extreme circumstances, ending therapy or transitioning to a new therapist is typically something that is planned and that you would discuss with your therapist. A therapist abruptly ending therapy with no communication in most cases would be unethical and would likely be something that you would report to their licensing board. But on BetterHelp or Talkspace, you can abruptly lose access to your therapist, not because it's the right time to end therapy, but because of issues with the platform. Remember those licensing waivers I mentioned earlier that came into effect due to the pandemic, allowing providers to temporarily practice across state lines? Well, I came across one story of a patient who had a good ongoing relationship with their therapist on BetterHelp when suddenly the therapist said they could no longer provide therapy due to the waiver in their state expiring. It would be illegal for them to continue therapy. It doesn't seem like these platforms took the temporary nature of those waivers into account when onboarding tons of new therapists to keep up with increasing demand. Talkspace handled this a little differently. In May 2020, they sent a memo to therapists to see if they would be willing to continue practicing across state lines after executive orders and waivers expired, offering to pay any legal fees that therapists might incur as a result. Experts at the time warned that this could lead to marks on therapists' records that would follow them forever, and worse, that practicing without a license is a crime in some states. It's unclear how many therapists took them up on this offer to potentially commit crimes, and it's also unclear how many patients lost access to their therapists over this. But that's not the only issue. If you Google BetterHelp or Talkspace therapist disappeared, you'll get tons of results from distressed people who don't understand why their therapist was abruptly removed from the platform. The general answer from BetterHelp and Talkspace appears to be that they'll give you a free month or two to go ahead and start working with a brand new therapist like nothing ever happened. They don't provide explanations, there's no pre-transition counseling, and you're not supposed to directly contact your therapist outside of the platform. They can just do this for any reason they want. They're not technically providers or provider groups, they're just supplying the technology for providers to work, so they don't have to worry about standards that might normally apply. So, let's look at an example. According to a 2016 Forbes article written by Todd Essig, a Talkspace therapist filed a complaint about a HIPAA violation she felt was occurring on the platform, citing what appeared to be a routine Talkspace procedure that she saw as a threat to patient privacy. If you're not familiar with HIPAA, there is a lot to it, but the part that concerns us here is that one of its goals is to create standards around data transmission to protect PHI, protected health information, which, in the simplest terms, is health information that can be linked back to a specific individual. So, after filing that complaint, she told her patients about it, and she resigned with 2 weeks' notice, intending to use those 2 weeks to do that pre-transition counseling I mentioned and help her patients move on to new therapists. But Talkspace immediately banned her from the platform. Then, a VP sent an email to all of her clients explaining that their therapist was gone. But what this VP neglected to do was BCC the recipients of this email, so they ended up all seeing each other's email addresses. All the patients' names, and therefore their identities, became known to each other. The next day, Roni Frank, Talkspace co-founder and former software developer, sent another email trying to downplay the breach and offering a month's refund and 3 months of free therapy. And I noticed this article and other articles about this incident didn't specify what the incident was exactly or name the VP who sent that whoopsie email. But in the process of researching this episode, I came across a relevant post on one of those sites where you can ask for advice from lawyers. It was from a few days before the story broke, and it appears to be one of the patients affected by this asking for legal advice. I'm going to just read from that, and by the way, she does mention her therapist's first name here, but I'm going to leave that out. Quote, 2 weeks ago, trying to find a therapist for PTSD, I joined an online company, Talkspace.com. They link you to a therapist who they feel best meets your needs. My therapist's name is blank. Blank has been helping me work out my PTSD. On August 4th, she emailed me and told me there may have been a breach into my personal file. She was called by Talkspace supervising therapist Linda Sacco that they would be looking at some of her patients' files to help guide her in her therapy and to look at how well she was at retention of her patients. At that point, Blank refused to allow anyone into her files. She either resigned or was let go by Talkspace. Later that day, I received a group email from Linda Sacco, which tried to tell her side of the story. Because she group emailed us, 16 different email addresses now know who Blank's clients are. End quote. And I did confirm the person that this patient refers to as a supervising therapist, Linda Sacco, was a VP of Behavioral Health Sciences at Talkspace from June 2016 to October 2017. So it does appear to be the VP referred to in that Forbes article that came out a couple of days after this post. The patient goes on to say, reasonably, that their concern is who got into their files and why they weren't contacted asking for permission. This is obviously super upsetting, and a couple of free months of internet therapy doesn't make it better. And this kind of calls back to what the therapist mentioned in their reviews of working for Talkspace. They have to review these files to make sure that they're engaging enough with their patients and that they're meeting their quotas. This type of monitoring goes on all the time on these apps without being disclosed to patients. And the thing the Forbes article points out, that goes back to the distinction I made earlier, is that in her follow-up email, Roni Frank said she was interested in helping these patients who had had their privacy violated in multiple ways become past or future satisfied customers. About this, Essig writes, quote, "Take note of the use of customer. Note she did not write client. She did not write patient. This is significant. Users of Talkspace are customers of a business. They are neither clients nor patients of a mental health professional. It is a business relationship, not a professional relationship. In fact, Talkspace explicitly defines itself as a platform. It is a business with customers and not a healthcare provider with clients or patients. And it is as a business that they promise both anonymity and confidentiality. They use the language of a clinical relationship, but that is not what Talkspace is. When Talkspace promises confidentiality, it is done with all the limitations and trust inherent in any company's marketplace promises. Talkspace defines itself and is only accountable as a business, not as a healthcare provider." End quote. And this speaks not just to the shift that happens when you're forced to act primarily as a consumer instead of a patient, but to the protections that you lose in that shift and the way that businesses like Talkspace and BetterHelp take advantage of that. The idea of a traditional provider breaching your privacy, abruptly ending your therapy, breaching your privacy again, and then offering you a partial refund to make the problem go away is nearly unthinkable. But because Talkspace and platforms like it are not regulated in the same way a provider is, they seemingly don't have to face any consequences, and they know this. In the piece, Essig goes on to state that Roni Frank told employees in an email to just literally not talk to him if he asked them any more questions about this for his reporting. They know they don't have to answer for it legally, and they try not to answer for it at all by trying to keep their employees quiet so they don't accidentally divulge whatever other illegal shit is happening. So what you end up with, if you spend the amount of time I have looking into this, is a lot of stories about how these apps have harmed people. You realize that these companies don't have an answer for it in the way you would expect, in the way their patients expect, even when they do actual harm or engage in activity that would be pretty much illegal for a face-to-face therapist, even when they try to incite therapists to commit crimes. And so, thinking about the broad range of both positive and negative experiences on these apps, and the way that this company responds to them, the takeaway for me is not to unequivocally say that these apps don't work or that they shouldn't exist, although that is what I personally believe. The real takeaway is that we don't know. There haven't been extended trials to show the potential harm that these apps might be doing. Even the research funded by BetterHelp and Talkspace calls for more research. So if you're using one of these apps that advertise themselves as being the same or better than traditional therapy, you're unwittingly participating in the trial run to see just what happens when you try to cram a traditional therapy approach with a good track record into an app that's designed with the primary purpose of pushing the bounds of the law to make tech founders rich. And at the same time, these companies seem confused about which patients they're equipped to handle. Higher risk patients might get turned away, or they might get accepted onto the platform and then be matched with a therapist who is not qualified to handle the extent of their issue. Patients who mention suicidal ideation or PTSD or other serious issues are sometimes turned away at the outset, but not always. The standards behind the intake questionnaires that they use are opaque. Because they're technically just offering a platform, they're not required to disclose anything about why they do or don't accept certain patients. But it is strange for a platform to sometimes accept people with severe mental health issues and sometimes not. For patients who get rejected, it can lead to feeling like it's pointless to keep trying to get help in the same way the other issues we've talked about can. But why not just say anyone who's suicidal or has a history of severe mental illness can't be on the platform at all? Whatever their standards are behind the scenes, it seems odd that they would sometimes risk accepting high-risk patients they know they're likely not equipped to handle, whether it's individual registrations or what they tried to pull with the Astroworld tragedy. But it starts to make sense when you consider that in a sense it doesn't matter if these patients get anything out of therapy or if they cancel after a month, because providing therapy isn't the only goal for companies like BetterHelp and Talkspace. They need to get as many users to install their apps as possible because they're also mining user data. This has been reported on extensively, so I'm not going to spend too much time on the specific violations committed by these companies. There have been many reports from current and former employees of both companies that private conversations between therapists and patients are monitored, both by automated means and by manual review conducted by other employees without the patient's knowledge, like we saw in the case of that VP. Of course, any algorithms that are used to monitor these conversations are also opaque, as is whatever they're doing with the data they collect. There was a good Jezebel article where reporters went through the sign-up process for both apps and were able to confirm that location and other data was being sent to Facebook, as well as to a research and analytics firm called Mixpanel. And of course, the companies claim that this data is anonymized according to HIPAA standards. But research has found that even data anonymized according to HIPAA standards can be re-identified and traced back to individuals, in some cases almost half the time. At the same time, the privacy policies of these companies make it unclear how and why they're using this data, while giving users the impression that there are no privacy concerns to worry about by stressing in their ads and on their websites that the apps are HIPAA compliant. The truth is, a lot of experts believe HIPAA doesn't go far enough. Going back to that complaint against Talkspace filed by a therapist kind of illustrates how these things play out. From what I can tell, nothing came of that complaint. I couldn't find anything about Talkspace being fined or held accountable in some other way, and that's likely because Talkspace, BetterHelp, and other apps like it don't fall under HIPAA in exactly the same way that actual providers do. If a provider did what Talkspace did, they'd likely be fined and possibly lose their license. But under HIPAA, healthcare providers, insurance companies, and healthcare clearinghouses are considered covered entities, while companies that provide platforms for providers fall under a category they call business associates. Covered entities and business associates are technically subject to the same rules, but the Department of Health and Human Services doesn't do direct monitoring or enforcement of its rules for business associate. So even if they received a complaint, it's unclear that they would do anything about it, and that's the kind of blurry area that these platforms operate in. So, despite HIPAA and updates to it, like the High-Tech Act that was signed into law in 2009, these companies are operating in what is in some ways an unregulated space. The High-Tech Act was meant to add additional protections by strengthening enforcement of HIPAA's privacy and security provisions, but while well-intentioned, 2009 is a lifetime ago in terms of how quickly this technology has moved and been adopted. The laws governing the way these apps can use our information were created in a world where these apps just didn't exist, where it was unthinkable that your location and other private information might be shared in the course of a therapy session. So, whereas in the 2010s there were concerns that the law hadn't kept up with the technology in terms of allowing access to these apps, now the concern has become that the law hasn't kept up in terms of protecting patients. So far, there hasn't been a major breach at one of these companies, but it's only a matter of time before something worse than we've already seen happens. And only time will tell how this data they're collecting and transmitting is being used. Just like we don't really know what the effects are in terms of therapeutic effectiveness and harmful effects, we don't know what they're doing with this data. Interestingly, some of the founders of these companies have Medium accounts, where they have sometimes written posts to respond to the supposedly false allegations made about their data and privacy practices. Oren Frank of Talkspace has a post titled Response to False Accusations Against Talkspace. In other words, my I'm not running a scam app that hurts people and sells their data t-shirt has people asking a lot of questions already answered by my shirt. Elon Matas of BetterHelp has a couple of Medium posts up too. These guys seem pretty defensive and fighty. They don't want other people to talk about what they're doing. They really, really want to control the narrative around their companies and the unethical practices they engage in. So Elon or Oren, if you're listening to this, hello. I would love the opportunity to chat with you both face to face and just... So, let's start to wrap up here. The last few years have seen a rise in mainstream discourse around mental health awareness. Get therapy is pretty much a meme at this point. You see these companies and their founders picking up on and repeating ideas about destigmatizing therapy and making it widely available. And I think there's a general sentiment that therapy is easily accessible, and if you want to be a better or more complete person, all you have to do is just do it. And to me, what's missing from this conversation, and what these apps miss with their focus on convenience, on-demand access, ease of use, etc., is that therapy is a lot of work. It's not easy. I don't say this to disparage therapy, but it's just not a quick fix. If you're having a serious issue, a free month just doesn't cut it. Texting and not getting a reply doesn't cut it. And you don't just seamlessly switch therapists as Talkspace advertises. Successful therapy involves developing a long-term relationship of mutual trust and respect with a qualified therapist who is properly equipped to help you, who speaks your language, and who isn't texting multiple patients at the same time or juggling a caseload of 50-plus patients while making close to minimum wage. But as I and many others have experienced, getting traditional therapy in real life has gotten a lot more challenging. It feels like the work of therapy starts before you ever even find a therapist, and it's probably only going to get harder. There's a widening gap in our healthcare system, and while it's felt more acutely in certain regions and by certain people, it's affecting patients in need across the country. And what apps like BetterHelp and Talkspace try to do is profit off of that gap without questioning why it exists, because there's no profit in that. The more we continue to put off looking at the real problem while putting technological bandages on it, the worse things will get. I don't know exactly what the solution is, but I do know that we deserve better and that we have to keep trying. We have to keep trying to get the help we need because that's the only way that we can keep trying to bring about change in a system that can sometimes feel like a tangle of indecipherable bullshit. So I hope listening to this kind of helped untangle that a little bit and provided context for why these things can feel so hard sometimes. It's because they're designed that way. This was by no means exhaustive. I could spend a lot more time talking about everything that's wrong with these apps and how much I hate them, but I hope this has at least shown that if you've had trouble navigating this, or if you've tried these apps and they haven't worked for you, you're not alone in that, and the problem isn't you. It really isn't. Thank you for listening. Take care.